started here at 916 in 2006. And pretty quickly after I arrived here, I started to see a pattern of younger and younger children being referred to our programs who had these very complex needs. And as a district, we were not really set up to serve a younger population. Most of the facilities that we were in were more high school oriented. And then secondly, it started to become clear to me through my interaction with our staff and the challenges that they were having in delivering the kind of program that they wanted, that the facilities, the traditionally designed facilities, were really part of the problem. Let me start by telling you what parents told us and our member districts told us before we built our facilities. They were telling us that our schools did not feel like a warm and welcoming environment. And so our members told us, if you are going to build these facilities, that warm and welcoming environment has to be something that you pay a lot of attention to. So going into it, conceptually, we knew this had to be something that felt a little different from what they had been experiencing prior to this in our districts and perhaps at their own district. We don't want to go all the way to the far end of the continuum and create what feels like a hospital environment, because then we risk, kind of going back to sort of an institutional feeling. But yet, what we learned from BWBR is that there were elements of the design in hospital behavioral health that clearly would help us with the goals we were trying to reach in our school environment, and we needed to blend those together. A lot of us that work here just really thrive on innovation, and it is so fun to be a part of a school district where you're a little less constrained on doing things different. Because part of my message to some of my colleagues actually around the nation is that you can take elements of what we figured out here, and if you're improving your elementary school and you already have a wing where you try to meet the needs of youngsters with complex needs, you can employ some of the same characteristics of the facility that we've learned here.